Peter Hotez now. He is the co-director of the Center for Vaccine Development at Texas Children's Hospital. Doctor, good evening to you.
Good to see you, Scott.
You heard from the report and our lead-in here. Some governors say yes, some mayors say no. This sounds like it's going to be one giant mess.
Well, I hope it sorts out pretty soon. And here's the reason. I think many of us were expecting this type of guidance from the CDC. In fact, I gave a lecture this afternoon that had a slide I made a couple of days ago and said it'll happen in June. So I think what happened was the CDC kind of got ahead of everyone a little bit and did it sooner than most of us thought. So I was expecting this sometime in June, so it's a couple of weeks early. I think it'll be okay, but I think the stores, the businesses, the universities need a little time to catch up and have some internal discussions. And over time, over the summer, as more and more people get vaccinated, as virus transmission continues to decline, people will have more of a comfort level with the new guidance.
But what do you say to people who suggest trusting the science goes both ways? If you tell people wear a mask because the virus is still out there, we wear a mask. Now the CDC says you don't have to anymore, but some governors say you still do.
Yeah, no, I understand the mixed messaging. Here's the reason why they did it. They've seen the CDC did it because of a sharp decline in the number of cases. And now anyone who wants to get vaccinated can get vaccinated. We have an excess of vaccines. But the other piece to this, Scott, is there's a new piece of science. And this is coming out of Israel earlier this month that's showing that vaccinated individuals, if they do get asymptomatic infection, it's about 90% protective against asymptomatic infection. If they do get asymptomatic infection, they're not shedding very much virus from their nose and mouth. So even though they have asymptomatic infection, we think they're not actually transmitting the virus. And that's really important news and should give parents some comfort, too. If they've been vaccinated, even if they're going out and about because they're not wearing masks and they get infected, they're not shedding enough virus to transmit it to their kids. We don't have all those I's dotted and T's crossed yet, but that's likely the piece that's missing right now that needs to be communicated. And I think that'll give a lot of comfort to parents across the country.
Do you think relaxing some of the mask mandates will actually cause more people to get vaccinated, or will those who don't want to just try and circumvent the system?
Yeah, the CDC's intent, my understanding, was not to do that. This was, some people are saying this was sort of a sly way to get to push the American people to getting vaccinated. I don't think that was their intent. I think they are showing that the power of these vaccines and how effective they really are. But the real reason, that we're seeing this big chunk of the country not getting vaccinated, unfortunately, is ideological, that they're tying their political allegiance to the political right, unfortunately, and we're seeing this play out in the bottom 10 states in terms of vaccination coverage, which are half what the top 10 states are. The bottom are all deep red states in the South and in the Mountain West. And so that's what we have to work on to get people vaccinated. This is not going to be trickery. This is going to have to be some hardcore convincing.
I'm wondering what you think the summer is going to look like. I think we're all thinking about that. And what would cause the CDC to have to go back and ask people to wear masks again?
Well, overall, I'm optimistic. I think we're already in New England, New Jersey, New York, California, New Mexico. We're already starting to approach Israel-like numbers. Israel's sort of the paradigm for how we should be in terms of vaccination rates, where more than 50-60% of the country is fully vaccinated, and even higher for single-dose vaccination. I think we'll get there for many parts of the country. The big question is the way the deep red states in the South and in Wyoming and Idaho are lagging behind. Will they get there? And if they don't, what does that look like? Especially if you remember last year at this time, we did pretty well. This was the nadir of our epidemic. But then as we hit July and August, we had that horrific summer surge in the South. And I'm worried something like that could happen again. Maybe not at the same magnitude because we do have vaccinated and infected and recovered people, but that's the big concern. That's the one thing I think that could go wrong is that regional flare-up over the summer.
Dr. Hotez, we will leave it there. Be well. We'll talk to you soon.
Shepard Smith here. Thanks for watching CNBC on YouTube.